Good. Hey everybody, this is Dr. Warren here at Kalkstein Chiropractic. Hi Michelle.
Hi.
She's a yoga instructor.
Just started.
Just started. Which is still pretty awesome. I like yoga. I'm a chiropractor here in Towson, but I also like yoga. I like lifting weights, I like running. I think there's a lot of good things that go towards creating health, overall health, right? And yoga is definitely one of those things.
Absolutely.
You love it.
I do love it.
Let me hear how much you love it. Come on, tell me. You've been teaching for how long?
I just started in July teaching.
Nice.
Practicing for a few years.
Yeah. I've only gone maybe 5 times in the last month and a half, 2 months. I'm not as consistent as you've been, but it does me wonders for sure. I feel like sometimes people love to do the things that they love to do, and people don't do the things that they need to do sometimes relative to movement. So like I'll get a lot of guys in here, I'm like, you should probably go to like a yoga class or do some Pilates, and you know, it's helpful to get adjusted. I really, not to sell myself short. But at the same time, you gotta like kind of build habits around healthy living. So they don't want to do that. They want to go lift heavy weights, right?
Yeah.
And then I get some other people in here, guys and girls, that maybe are much more flexible, and they just, you know, they tend not to want to lift weights as much, right? And so finding that balance between stability and mobility is like a real thing. And I digress to talking about yoga because I think it's healthy for a lot of problems. And I think it's also healthy when you have sciatica in the right doses. And so, Michelle, you've been dealing with some sciatica.
Absolutely.
Well, step back with me. Tell me a little bit about your journey here in the office. You've had some help with other problems here before.
Yeah, you fix all my problems.
Whoa, appreciate you.
I just got a new one, and now I need that fixed.
Let's do it.
Okay.
So quit talking and get to work.
No, you can talk.
I appreciate it. Yeah, so we've been working on this. So she had it started, really increased, ramped up biking, and how much she was doing, and that might have been one of the leading causes to what presented this problem.
Probably also I thought it would go away on its own.
It just kind of, and sometimes it does.
Yeah,
sometimes it does. But when it lingers beyond like a month, and you're still not getting that shift, and if it's still getting there, and you're doing some things, and it's aggravating it. A lot of times with nerves, they are. It's similar in our treatments for them. So if you have sciatica, or if you've got a pinched nerve in your neck or your low back, and you're feeling things get exacerbated farther down the chain, if you will, of the way they travel, that activity is, and it's probably doing more harm than good, right? And so you got to be mindful of that. And then vice versa, when I treat people with their leg symptoms or their arm symptoms, I really want to make sure, even in the moment, that what I do is creating less of that noxious stimuli, that ischemia, the compression on a nerve. And so that's kind of a terminology that we like to use for here. So you ramped it up.
Yeah, my piriformis is now locked on it.
Locked up.
Yeah.
And so we've been treating it for the last like month and a half.
Yeah.
And we've had good moments.
Yeah, but I haven't really stopped doing everything I probably should lay back on.
Well, appreciate, yeah, you know, that the insight, if you will.
Yeah.
And really trying to get on top of this in a beneficial way. Sometimes the reason I'm doing this video, right, is because it's not all roses here at Kalkstein Chiropractic all the time, and sometimes we got to deal with a problem a little longer than just a month or 2. Sometimes it takes some time to really work this stuff out, especially when it's gotten to a point where it's really stubborn like this. So there's a couple things that I'm doing with Michelle here. Why don't you tell us?
Dry needling, massaging, the thing that feels like a tattoo. What is that?
The radial pulse.
Yes. We did the traction table. So I've done everything.
You've done
and
great.
then laser.
That's 5 things.
Which I've done laser for other things, and that actually really works well.
Yeah.
And dry needling is amazing.
How was the laser today with on the hip? Did it feel better?
Good.
Okay, gotcha. So there's definitely been a lot of modalities. We use them quite often in combination to treat different problems, especially when there's complex components like this. So she's got, you know, disc bulge at that level in her lower back, and she's got a history of this problem before. She ramped up her activity, and it was almost a little bit of the perfect storm, and now sitting is really driving her leg crazy, and
terrible. It's torture, but I can't just keep moving.
no.
That's not an option.
You do have to sit every once in a while. This whole
Right,
intro.
I'm sitting here, so when I get up, you'll see.
Yes. So I'm going to show you and demonstrate how I do the soft tissue portion, the adjustment portion. And you might be wondering, why is he demonstrating something that's, she's getting all this stuff done? Is it helping her? Would you say it's helping?
Yeah, it helps,
Okay.
but then sitting locks it up. And then I really probably should stop biking for a little bit.
Okay. This is more of an intervention video than it was.
An intervention.
No, I think that a lot of times I had a conversation with a patient today about this similar problem, and it was about 2-3 weeks of care, and I'm like, you just have to be patient over time. Sometimes these things can be 4 or 5 months. Hopefully not the case with you, I know. But, sometimes we tend to jump away and say, oh, okay, boom, I'm going to go get the discectomy, I'm going to go get the injection, and a lot of times these are based off the opinions that you get provided by your medical provider, so there's a lot of things that go into that information. So I will say that it does take time, right? And some of the best people I've seen in medicine explain this to me that aren't in my profession have really urged me to be patient with some of these problems, as long as, one, I'm maintaining function in the leg. She's still going to yoga daily, she's still biking, she's still active with work. She's hurting a lot in these situations, but
while I'm working out and doing all, I'm fine.
Yes. Which is good.
Except for yoga when rounding my spine and certain leg things,
Yeah, so there's no increase in deficit of motor loss or function, and she's not getting, and we're monitoring this stuff and making sure that the sensory portion of it isn't getting worse. The sitting is an aggravating factor, and it's making this feel very stubborn. But if you're dealing with this type of problem, be patient, be consistent, keep focusing on the things that bring you good health over time. And although it might feel like a struggle right now, it'll work out. Okay, body's pretty amazing that way, and you felt this before in the past, and where it's gotten better. So we're going to lean into that right now, and then I'm going to monitor. And if I have to re-eval and refer out and use other providers, I'm definitely going to do that with Michelle, okay? But based off her goals, her needs, and her clinical history and presentation, we're sticking to the treatment plan, all right? Deal, okay. Break for us to set up. Thanks. So Michael's helping me out with what's called ART. It's a technique. This is pin and stretch is like kind of the general form of the technique, but ART is active release technique. I'm working on the piriformis and the sciatic nerve kind of in one go. Thanks, Michael, for your help.
Oh, my pleasure.
Michael and I are going to be running this weekend. You going to join us? You want to run on Sunday?
I don't run.
Saturday.
I do anything but run.
You didn't run?
No.
Long distance
Sounds
biking?
like a terrible idea.
A lot of people say that to me.
I like biking long distance, which got me into this situation.
Maybe you might reread that. Come on. So I'm applying a fair amount of pressure with my hand down, thumb into the back of the piriformis and the glute. And then right there, she's creating a lot of tension from Michael twisting her leg in that position. So only externally rotate the hip and then adduct it, bring the knee down towards the floor. It lengthens the piriformis muscle, but it also takes the sciatic nerve, which is slacked right now, and starts to slowly lengthen it. So this is a muscle technique, but for Michelle's case, I'm definitely more focused on her sciatic nerve. And so if you have sciatica, just the position she's in right now, it's called a static opener in my world, but it's something that can provide a lot of relief to some of the nerve pain that she's got. So if she were just to kind of swing her legs over in the morning when it can be at its worst, and just lay the leg over the side of the bed and hang out there for 2 minutes, 3 minutes, and let it open up. It's a nice way to get going in the morning, as well as some other stretches that we can show you later on. Good. Pressure? Yeah.
You're great. The pressure is torture, but it works.
We'll do 2 more just like that, and then we're going to start to lengthen the leg a little bit. So wait, they do Bikram and hot yoga?
Bikram.
Is all Bikram?
No, we do yoga.
So yeah,
Vinyasa.
Vinyasa, that's the difference. you've learned Bikram.
Yeah.
Oh,
I
nice.
know Bikram.
You did.
Mm-hmm.
Have you taught the Bikram course yet? Class?
Yeah. That's all I teach.
Go ahead and straighten that leg. Two more, Michael. Thank you so much. Appreciate your help.
My pleasure.
Is it?
Now your pleasure.
Just breathe.
Easier said than done.
Mm-hmm.
Yeah.
Mm. So we'll go up, and a lot of times with this problem, there's an exam, right? That we do in the beginning with her. There's an audit, what we'll call, when we do something, we want to see it improve. For her, it's a little bit of movement in her low back when she's standing. So we'll see that. Sorry, tuck you back up there. I didn't do this service and tuck you back up, so appreciate you.
No worries.
Thanks for your help.
Thank you.
All right, let's do the exam portion of it now, Michelle.
All right.
So go ahead and step off for me.
Off.
Yeah, face this way, and I'm gonna. All right, so I'm gonna watch Michelle move from side to side now. Okay, bend to your left for me, Michelle. I'm looking at this line right here in her low back, and then and her general range of motion, as well as how far that hand goes down, how easy it is for her to move into that side relative to the other side. So when she goes into the side of the complaint, and when she goes towards that area where she has that pinched nerve, her body goes, oh. So if you're dealing with that at home, you can kind of test out, oh yeah, that's where my problem spot is, that's where the pain is referring. Sometimes it can be opposite. You have the pain going this way, but you can move really well into the pain, hard to move away, different issue, usually in the spine. But for Michelle's purposes, you're going to be lying on your side, facing that measure. So upstate New York, was it fun?
The Armonk is not really upstate. But
Where is
yeah,
it?
it's nice.
White Plains?
Yeah, it's near White Plains.
Bring a bike.
No, it was family time. I wasn't allowed to escape for a few hours.
Why would you want to escape from all that family time, right?
Right.
Right. I'm sure your
And
family.
it was torrential downpours on Saturday.
Was it? So it's easy compression. Shoulders are loose with you. Loose. Good. Good. Lie on your back for me. Cool shoes.
Oh, thanks.
Were you a skater?
No,
No.
not at all.
Never.
Never. They're comfortable.
Lie on your side here, face me. Massage, traction. So the visits that Michelle gets massage therapy, she just gets adjusted when she comes in. There's other visits when she's coming in where she's getting dry needling and traction as well as getting adjusted. And those are separate from today's visit, for example. Right? And so we're combining those things together to create a little bit more of a full spectrum treatment plan for her, get her feeling as good as possible. And then every so often we're trying to convince her not to ride 100 miles in a week, but
A week?
a lot.
Yeah, it's a little more than that, but we won't talk about that.
Good. So you just saw how I treat the problem. Hopefully if you watch the beginning, if you're not like Michelle where she just fast forward to it, you can get a general understanding if you have sciatica that it can sometimes be some time, and a multimodal approach is one of the best approaches. But the best thing she's got going for her, she's headstrong and she's consistent with wanting to do healthy things for herself. So that's why I'm very confident that we'll get on top of this problem for Michelle and she'll be feeling good in no time.
I'm confident in you too.
I appreciate the confidence in me. How's that all feel?
Good.
Good.
Pure foreign stretches hurt, but they work.
They work?
Yeah.
Good. Awesome.
Until I sit down in the car.
No sitting. Just run home. Okay? Get on your bike.
Alright.
Head home.
It's on my car.
Thank you for doing the video with me. You did
Oh,
it.
you're welcome.
Yeah. Appreciate you guys watching. Hope you have a wonderful day. Feel better if you're hurting.